Misuse of alcohol and/or drugs can have a severe impact on your mental and physical health. Substance misuse is the continued misuse of any mind-altering substance that can severely affect your physical and mental health, social situation, and ability to have control of your life. Most forms of substance misuse may give you a temporary feeling of well-being or of being in control, but all of them can ultimately damage your health. Substances such as drugs, alcohol, nicotine, and solvents can start as props to help you get through difficult times, but the feelings of relief are only temporary, and, as the underlying problems don't disappear, you may use more and more of these substances and risk becoming dependent on them, which creates new problems. The most severe forms of substance misuse are normally treated by specialist drugs and alcohol rehabilitation services. There are many reasons why people start to use drugs or alcohol. Some people begin because of curiosity, rebellion, or influence from peers, while others may start if they are unhappy or stressed or trying to cope with problems in their life. Some people may find the experience enjoyable and want to repeat it, and it can then become a problem. Two of the most common forms of substance misuse seen in drug and alcohol services are alcohol and heroin. However, there are also many people with cannabis and cocaine dependency, and there is an increase in people accessing services for support with medicines bought in pharmacies or prescribed by GPs, such as anxiety and pain medications, as well as medication bought online, including steroids. You are taking a risk with your health if you are taking medication that has not been prescribed by a doctor, hospital, or pharmacy. If you buy medication online, you don't know what you might actually be taking. There are often signs and symptoms that might indicate drug misuse. These might depend on the type and amount of drug. Changes in normal behaviour or routine, sudden mood swings, loss of interest in hobbies, lethargy and low motivation, withdrawal from family and friends, changes in sleeping pattern. In the UK, the legislation classifies illegal drugs into 3 classifications. Class A drugs: crack cocaine, ecstasy, heroin, LSD, magic mushrooms, methadone, methamphetamine, crystal meth. Class B drugs: amphetamines, barbiturates, cannabis, codeine, ketamine. Class C drugs: anabolic steroids, benzodiazepines, diazepam, cat. It is a criminal offence to be in possession of illegal drugs. If you're under 18, the police are allowed to tell your parent, guardian, or carer that you've been caught with drugs. For possession of Class A drugs, the sentence is up to 7 years in prison, an unlimited fine, or both. For possession of Class B drugs, the sentence is up to 5 years in prison, an unlimited fine, or both. For cannabis, police can issue a warning or an on-the-spot fine of £90. For possession of Class C drugs, the sentence is up to 2 years in prison, an unlimited fine, or both. Alcohol dependency. The amount of alcohol in drinks is usually measured in units. 1 unit is 10 mils. On average, it takes about an hour to process 1 unit of alcohol, although this may vary from person to person. 1 unit equals 218 millilitres of standard 4.5% cider, 76 millilitres of standard 13% wine, 250 millilitres of standard 4% beer, 25 millilitres of standard 40% whiskey. It is recommended not to drink more than 14 units a week. If you are pregnant, you shouldn't drink alcohol at all. Drinking alcohol can cause health problems to you and to your baby. Drinking alcohol excessively and for a long period of time could possibly result in long-term health problems, including brain damage, stroke, overdose, fits and seizures, anxiety and depression, liver disease, reproductive dysfunction, pancreatitis, heart disease, cancer. If you are worried about being dependent on alcohol, symptoms to look out for might include anxiety after waking up, excessive sweating, vomiting, hallucinations, fits and convulsions. Reducing alcohol intake has lots of benefits, such as improved mood, better sleep, improved relationship, more time for hobbies and interests, better physical shape, reduced risks of drink driving, saved money. There are strict alcohol limits for drivers, but it's impossible to say exactly how many drinks this equals. It's different for each person. The legal limit of alcohol is 35 micrograms per 100 millilitres of breath. If caught and found guilty of drink driving, you could be imprisoned, banned from driving, and face a fine. You may still be driving illegally if you have drunk alcohol the night before, as it takes some time to leave your body. If you or someone you know needs help with substance dependency, your doctor is a good place to start. They can discuss your problems with you and get you into treatment. They may offer you treatment at the practice or refer you to your local drug service. You won't get in trouble for admitting you have a substance addiction. If you're not comfortable talking to your doctor, you can approach your local drug and alcohol treatment service yourself. The current provider of drug and alcohol treatment services across Cambridgeshire and Peterborough are CGL and Aspire. They can provide support for those with substance misuse issues and support for their families. Their phone number is 0300 555 0101 or visit their website at. If you're having trouble finding the right sort of help, call the Talk to Frank Drugs helpline on 0300 123 6600. The Talk to Frank helpline offers support for anyone with questions or concerns surrounding drugs. You can find more details about what they offer on their website.